Hi there, my name is Sarah Price and I'm a student at the University of Colorado School of Nursing. This is my video assignment for NURS 4080. As I said, my name is Sarah and I hope to practice nursing in the emergency department setting in Colorado. The definition of nursing. According to the World Health Organization, quote, nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities. Sick or well in all settings, it includes the promotion of health, the prevention of illness, and the care of ill, disabled, and dying people. Nursing exists this is my thoughts, not the WHO, exists to provide direct care and hands-on implementation of medications and procedures, and the direct care, which is often indicated by protocol, patient request, or provider orders. I want to practice nursing because I have always been a scientist and interested in the healthy and ill human body, but I have also always known that I wanted to be hands-on and spend a lot of time talking to, touching, and educating those humans that inhabit that human body. Underlying beliefs about nurses, I think we are definitely the last line of control of the patient experience, as well as the safe implementation of their care. Beliefs about patients, I think it's important that nurses remember when they interact with patients that these patients are often experiencing illness and at their worst days. Because of that, it is important to care for patients equally and not judge, particularly when it comes to a patient's ability to maintain their own health. Lastly, underlying beliefs on other providers, they are teammates with similar goals, and it is important to work together and trust one another. And communities can have a huge role in patients' health status, both good and bad. Also important to remember communities in terms of within nursing, whether it's the coworkers on your floor, in your hospital or clinic where you work, or within your specialty. The four meta paradigm concepts of nursing and how they relate to professional practice are the first being the human or the person. Each human is different, and although we have similar physiology, it's important to acknowledge that each individual's health and their perception of that health has been shaped by their own experience. Health, as a term, incorporates wellness and illness, and it reminds us as nurses to consider the whole person when thinking about health, not just the affected body system or the limb or appendage that we're focusing on. Another paradigm is environment, and it includes not only one's geography, but their social realm and their personal interactions. As professionals, we have to meet others where they are from this environment or where they exist in that environment. So, for example, nurses have to always remember to explain things in a way that is relevant to the patient and that they understand. Last paradigm is nursing practice, and it's both an academic or scientific discipline, but also a hands-on professional practice. So nurses must rely on their knowledge, both from science and academics, to implement a successful and compassionate practice. How are all four of these connected? I think that these four paradigms, these four concepts, define nursing as a discipline separate from all others, and as a professional practice. The four concepts make up a foundation for all the other nursing skills and theories to build on top of, whether that is learning more skills as we do as students or branching into different specialties and how those skills are approached. So regardless of specialty, all nursing practice must rely on these four aspects. The first three define the experience of the patient, and the fourth is an umbrella concept that the nurse implements, taking the patient concepts into consideration with his or her implementation. My vision for the future of nursing is as the education of nurses rises, as exemplified by the requirement of bachelor's or BSN for all nurses at some facilities. That's becoming common practice. And the firm establishment of master's, DNP, and PhD roles. The discipline will become more autonomous and more recognized for their clinical judgment. A rising tide raises all ships, as they say. So as the profession education is lifted, all nurses will feel the effects of that. As I go through my clinicals as a student, I see challenges already that I will confront in my practice, particularly some older, outdated framework or ratios or duties of nurses stay in place because they're established, but their care of patients becomes more demanding as patients are sicker. They're more numerous as the baby boomer generation grows and expands their healthcare needs, and care is becoming more expensive considering technology and new drugs and cost of the facilities in general. So all of those things are changing while an established framework stays in place, which this disparity is going to continue, and nurses will need more support from one another and from fellow professionals. In my own professional development, I'd like to establish as a career as a professional nurse and implement my knowledge gained at school and going forward through excellent clinical judgment. I also would eventually like to mentor and help precept other new students and nurses. Thank you.